2022. Fantastic to see you all here after the horrendous 2 years we've had. I know some of you have been COVID testing, volunteering, struggling with your lectures online. I hate lecturing online. I can't see your face. I don't know if I'm inspiring you or engaging you or if you're asleep. I don't care if you're in your gym jams, but it's about coming back together and networking, and hopefully that's what today is about. So I want to open today with a thank you. Thank you for coming down. We're going to be talking about some of the different careers in biomedical science, some of the things that you might want to think about, some of the things you might not have known is available to you. It's about networking, asking questions. I know there's quite a few universities here today. We've got Stafford, who else we've got? Salford, Gloucestershire, York, St John. Anyone else that I've not mentioned? Essex, yes. Anyone else? Yeah. Oh, wow. It really is great to see that you've used your own time to come on down and to just find out a bit more. It is a competitive field, so it's really about finding what you want to go into, what's available to you, thinking outside of the box, and networking. I'm going to be saying networking all day, so just get used to it. So yeah, we've got a really packed schedule ahead, so let's get started. So for those of you that might not be aware, the IBMS, or the Institute of Biomedical Science, is the leading professional body for biomedical scientists, support staff and students. There are thousands of members and it's worldwide and it's growing. And these three values really underpin what the IBMS and what I actually believe the IBMS stands for. So support in terms of qualification and standards, progress, training and promotion of our profession. And I say our because we are all in this same profession in biomedical science. And talking about promotion, the IBMS is the voice of the profession. Some of you might have seen in the media over the last couple of years our past president, Alan Wilson, or Dr. Sarah Pitt speaking on the news, on the BBC, about who we are and what we do. So often, at the beginning of the pandemic, it was thought that perhaps it was medical staff that were doing all of the COVID testing, but no, it was students, it was biomedical scientists, it was laboratory support staff. We're here, and the IBMS is trying to be our voice. So I said we've got a really packed schedule, and I'm really going to try and zip through all of this. You might find this schedule changes up a little bit. We're just going to run with it as if it was planned. We have got a very quick break at 2:30, 10 minutes, but we've got a bit of a meatier break a little bit later on at 20 to 4. Crucially, tea and coffee is going to come to us, and I'm looking at my colleague because hopefully it definitely is coming to us. And that means you really get an opportunity to mill around. Look around, chat to each other. Come and chat to me. I'll be here. I'm more than approachable. Some of you might know I'm on Twitter. Hashtag IBMS chat. We'll go into that. You can find me. Come and chat to the panel. Today is really about you, finding out what you're interested in and what the options are available to you. Just want to really briefly just capture some of what today's about. So it's networking, asking questions, career advice, and learning something new. It might be that you didn't know that there are so many different varied careers in biomedical science. Really briefly, want to touch on the IBMS eStudent membership. This is a fantastic opportunity to get involved with the IBMS. For me, it's about engaging in a network. It's about being eligible for awards and bursaries and discounts. So the IBMS do the fundamentals of biomedical science textbooks. I don't know if any of you have seen them. They do a microbiology one, a virology one. I use them. I use them in teaching students. I use them in training support staff in the laboratory. They are really nice texts. I'm not on commission. You do get discount with the IBMS eStudent membership, and I really do recommend these textbooks. It's £12 per year. You can do this online. Just direct you to the IBMS website, which is ibms.org. So, for those of you that might know me, I'm going to plug IBMS Chat. This is an online platform that meets on the first Wednesday of every month on Twitter, 8 PM to 9 PM. And this is a massively, I really can't stress, a massively inclusive network. It really doesn't matter geography, your specialism, your years of experience, a student, a consultant, a biomedical scientist, overseas. We'll come together and we'll discuss a loosely set topic, but then you can ad-lib and you can throw out questions. I've got this interview coming up. I have no idea about this area and how do I even get into it, and do you know someone, and can I come for a tour? That's what it's about. It's at every stage of your career, networking. An IBMS Chat, thanks to shifts, we're probably online 24/7 at some point. Tweet me, tweet using the hashtag, we'll pick it up, and there is a massive network out there. And as I say, today is about you, but it's also about networking. So I'd just like to end with this very short video that's not coming up. Yep. Just to give you a flavour of some of the opportunities in pathology.
I helped 278 patients today. My name is Hazra and I'm a medical laboratory assistant. I screened patients for MRSA today. Laboratories are important because they provide results that help manage infections. My role is important because it helps patients.
I helped 47 patients today. My name is Fiona and I'm a clinical scientist. I helped to diagnose an immunodeficiency today. Pathology laboratories are important because clinical research couldn't happen without them. I love my job because every day is different and even a bad day is a good day.
I helped 25 patients today. My name is Lakshmi Narayan and I am a consultant histopathologist. I gave a patient's breast lump the all clear today. Pathology laboratories are important because they provide results without which your surgeon or doctor cannot focus on the right treatment. I love my job because we complete the diagnostic jigsaw.
You may not always see us, but we are here for you 24/7.
Always there for you.
Working hard behind the scenes.
We are skilled.
We are dedicated.
Every sample represents a patient.
Every patient is tested.
And every patient matters.
So I was actually part of the working group that created this video about trying to inspire our workforce and just show you some of the roles. If you put that hashtag Pathology Raw into Twitter, you will find a link that will take you straight to all, I think there's 17 or 19 different videos, just to give you a little flavour. And it might not be the next role that you want, but it might be, do you know what? I quite like the idea of being a consultant. Maybe I'll look at that, and it's all within pathology, and it is all within your grasp. So I'd like to conclude there and invite my colleague Michelle onto the stage, who is going to talk to you about haematology. Thank you.
I've put 10 minutes on my timer. Cherie said 6 to 10. 10 minutes of haematology. How can you start? This is where I work, central Manchester. The coloured bars at the front are the new Children's Hospital. The bars going blue behind the St Mary's Women's Hospital. Behind that you can see the yellow bars of the Eye Hospital. What you can't see sprawling out behind that is the adult hospital. So it's a huge complex on site, and if you follow the sky bridge over the roof, you'll come down in the laboratory block on the other side. And the laboratory is the centre of the hospital, but it's actually physically linked by a sky bridge. So it's a huge amount. We have 2 of everything because we've got adults and children. So we've got 2 A&E departments, 2 stem cell transplant units, 2 hemoglobinopathy units, 2 haemophilia centres, and that they all come to the laboratory complex. So the laboratory in haematology looks after all of that. So while nobody knows who you are in the lab, nobody will ever say thank you. You're not going to get the roses and the flowers that the nurses and doctors get. You don't exist. you are 70% of the patient's notes, and you're there 24/7 in some way. So it's a key role. If you're looking for praise and thank you, you better go somewhere else. But if you're looking for something that's rewarding, that's like that video says, is different every day, and that you're making a difference to someone, you're not just wrapping up cakes, you're actually making a difference to lives, then you're probably looking in the right place. It depends how much you want to speak to people. Can I just ask, did anyone other than me go to the country music festival last week? No? Country music fancy? You missed Ashley McBride, she was very good. Okay, so haematology. You tend to think of it as cell counts, and I suppose haematology is what biochemistry throw away. So biochemistry and haematology are the central ground floor hub of a hospital lab. They're the big turnover tests. You stand at a bus stop round the hospital, you will have a haematology full blood count done and using these for chemistry. They want the plasma and the serum. We think of haematology as wanting the cells. And that's how we tend to work. If you go to somewhere smaller, you'll probably find that haematology and biochemistry are a multidisciplinary team, that you will learn both of those things. So there's going to be different horses for courses, so to speak, depending on whether you go somewhere small or whether you end up working somewhere large. We're a large lab, we've got so many specialties within haematology, it would be impossible to do chemistry as well. So we don't multidisciplinary, but a smaller place would do, and they might do a bit of micro as well. Within haematology, we tend to think of blood transfusion. That tends to be part, although once you get specialised, you can choose to move through different areas of haematology. You might want to stay, blood transfusion might be your focus. You might want to stay in coagulation, clotting disorders. You might want to stay in general haematology, looking at the full blood counts and blood cell morphology. That happens to be my bit, looking down the microscope. And beyond that, there's a chance to link in with cancer diagnostics. I'm actually the Chief Biomedical Scientist for the Haematological Cancer Diagnostic Service in Manchester. You can get involved in stem cell therapeutics. I spent 12 years working in a cryopreservation stem cell preservation lab before moving back. And we work closely alongside colleagues in biochemistry, particularly 24/7 aspect of it, and immunology on the cancer side. It's 24/7. So haematology and biochemistry, no matter where you work, big or small, tend to be 24/7. If the hospital's got an A&E department, then there's always someone in the lab. No one ever thinks of that, but they are. And you train for those things. So you'll be trained to work for major incidents, dealing with road traffic accidents, shootings, stabbings, whatever. So it's all part of the invisible heart hospital. The patients don't know you exist, but you are there. If you're looking for a job where you don't want to work nights or you don't want to work shifts, you're going to have to think about that sort of thing, because haematology and chemistry do that. Having said that, I've worked a whole career and probably never worked a whole night shift. I've been called in a lot. I've done major incident stuff, and I've done advice on morphology and advice on phone calls, and I've been in for clotting help. But there's so many people doing so many rotas that there's always room for somebody in it, in a larger place. In a smaller place, you might find those options are less, that you are required to do certain things. And certainly when you're starting out in your career and you've got to get to a certain level before you start to specialise, then you'll find yourself in those sort of patterns, because at the end of the day, it's a service. You're a service to patients, and anybody can walk in through those doors at A&E at any time, day or night, with absolutely anything. So inside the lab, there's a lot of automation in a big lab. For haematology and chemistry, that would be the same. So if you think, well, I don't want to work in a factory-style environment, you've also got to think there's also a lot going on. So we would do 2,000 full blood counts every day of the week. Now, nobody's going to stand there and do that with a test tube. It's highly automated, a big rack of instruments. Coagulation has also got analyzers on platforms to get clotting studies done quickly. And then somebody like me, or like one of you in the future, writes the rule bases within the instruments that tell them against age and sex what the normal intervals or reference ranges are, so that tests can come in, get processed and go out without actually the human being having to look at them. The abnormal ones all end up in front of those two people, those two biomedical scientists that you see sat there, and then it's their job to start knowing with their skills and knowledge what to do next, whether they're phoning something, checking something, adding more tests, do they add a glandular fever screen, do they add more clotting studies, and do they send it for a blood film? And then you take them, the most abnormal samples, put them up on a glass slide, stain them, and put them under a microscope, and that's my thing. Now, these pictures you see here, blood cells that you see, are hand-drawn by somebody called Dorothy Stern back in 1956, and no, I wasn't around then. That's before my time. Well, blood cells, basically, you'll never come across more beautiful than the ones that she drew. But the abnormalities and the interest, what you can see under the microscope, for me is massive. So every day of the week, we would expect to see in our hospital 1 new leukemia every week. We're going to get malarias coming in, and the person looking down the microscope's got to be able to tell the difference of anemias, to leukemias, from malarias to various hemoglobinopathy and blood disorders. All that forms part of the haematology baseline, and you're all working in a team. So yes, you don't have to stay on the automated side. There's specialisms in coag, there's specialisms in transfusion, there's specialisms in general heme, there's specialisms in hemoglobinopathies, looking at the more complex blood disorders. So you start off on a base, you work as a team, you'll find your area, maybe you'll turn to specialise in one area or another, maybe you don't want to do that, maybe you want to stay general, and it's more important that you do you can base your life around your family and home, but you're making a difference with whatever that is, whether you're just phoning the student health centre to say yes, it's another case of glandular fever, or whether you're actually phoning other news through and contacting GPs over leukemias or severe anemias. How am I doing? 2 minutes. So we're there, in theory, to add value to the data and to make sure that the data is right. It's all right having the best analyzer in the world, but you've got to keep it controlled and understand when it malfunctions, understand interference substances, understand why test and results aren't always what they seem on the paper, understand the limitations of kit results that don't test everybody. We've all been going on about, we all understand about COVID test kits now, and we all know that they're not always positive when someone's got COVID, and they're not always negative when someone hasn't. That's the same for every kit test you can think of, from glandular fever to malaria. So understanding those limitations. You need to be able to describe the clinical abnormalities and sort out the relevance. Know what needs phoning, know what needs passing on, know when something's critical. Impact on patient care. You're making a difference. You're getting that information through to the clinical team so that they can take the credit, so that they can make the decisions and get the right job done. You've got to be efficient and effective. We are a service laboratory in haematology, blood transfusion. It's a 24/7 system. Blood products, specialist assays, specialist investigations. And as I've already said, we tend not to think of laboratory people very much at all. The public don't know us as biomedical scientists. It's a very quiet, hidden people. Maybe it takes a certain sort of person to work in a lab. But there are opportunities to get involved with things like this. I've just run a big quiz on blood cell morphology this morning in which 600 people across biomedical sciences, not attending today, I put it online last week, have all had a go. So there is an interest and a collaboration, if you like, across the country where we all like to know what we're doing and what sharing some information in interesting cases. We tend to do that. I started my career a lifetime ago for you people with what would be the equivalent of 5 GCSEs. And I've loved every minute of it. And for a job that doesn't do a lot, I've now got a professional doctorate in morphology reporting. I've given lectures on morphology in the United States, Australia, and China. So, in the words of my country music hero, Ashley McBride, not bad for a girl going nowhere. So there is something for everybody. But I've done me 10 minutes. Thank you.
Lovely. Thank you. So what I'm hearing is that there's something different. There's something for everyone. And perhaps I'm going to carry that on now in my talk, where I'm going to be speaking to you about virology. And it's going to be something a little bit different, a hybrid, if you will, because I'm going to speak to you about virology and serology, because although I think of myself as working in virology, I actually do more serology, although they're very, very similar. So let's just take a minute to take it right back and just consider what is pathology. And although on today's lightning talks you're going to hear about clinical microbiology, we've heard about haematology, I'm going to give you a flavour of virology and serology, but there are, I think RC Path put it at around 17, around 20. You've got cellular pathology, immunology, forensic pathology. So there really is something for everyone, really, actually, I think. So virology. What is virology? Well, in the very most basic sense, it's the study of viruses. But what are viruses? They're really, really, really small protein packages. It can be an RNA virus, a DNA virus. You can be asymptomatic with a virus, perhaps COVID-19. Or you can have devastating disease and ultimately death. Lots of different modes of transmission, so fecal oral, mucous membranes, vertical transmission, so mother to baby. And the mainstay of testing is usually looking at the immune response in most laboratories. So we're talking IgM or IgG, nucleic acid testing, so PCR. And I would challenge anyone in this room not to know the word PCR after the last 2 years that we've had. So you're not going to see these under the microscope. It's going to be a lot of automated testing, but what we'll go on to see is that it's not always automated. So how many viruses? I really, really did try to Google this and find out how many viruses we can actually test for. I have absolutely no idea, and if anybody actually does find it out, let me know. So in the main laboratory, we would be testing for things like varicella zoster, chickenpox, measles, mumps, rubella, so this is occupational health testing. So myself, as a biomedical scientist, I've been screened. Antenatal clients or antenatal patients, so those that are pregnant, we're going to be looking for HIV and hepatitis B. And we've got respiratory and enteric, and then we've got the really scary, so viral hemorrhagic fevers. And I don't know if anyone heard about Lassa fever over the last couple of weeks. Yeah, very scary. So these sort of viruses are going to be handled in containment level 4 facilities. So these are few and far between. We don't have a Cat 4 in my lab. I'd probably be a little bit scared handling these sort of samples. But the option's there. If you really, really want to go there, the option's there. So serology. Serology is usually the identification of an antibody response to infection in the serum. So we're spinning down a whole blood sample. So Michelle over there, she's primarily using whole blood. We're going to spin it down and we're going to take off the serum and we're going to perform testing on that. But serology is not just testing for viruses. We're looking at bacteria, so Streptococcus pyogenes. So that's the causative agent of strep throat or scarlet fever. We're looking for fungi, so galactomannan or beta-D-glucan, so fungal markers, or Cryptococcus neoformans. And I'm shooting out all of these words, and I know some of them are a real mouthful, but just going to stop there. And it's these sort of things that, for me, as a university lecturer on the side, slipping these sort of things in an exam is really taking it up to the next level, because you might not be learning about this in your normal lectures. And then you've got viruses, so HIV, VZV, EBV, CMV, spirochetes, so syphilis, Treponema pallidum, and Lyme disease, so that's Borrelia burgdorferi. Cute! Pandas. Why on earth has Cherie put a picture of pandas in her lecture about virology? Well, when I sat and thought, how am I going to talk to a room about virology and how am I going to make it interesting, because it can be very dry. And I thought about, why do I love virology or serology? And for me, it's the infinite number of clinical scenarios. So pandas, this was a particular clinical detail that I saw on a request form one day in the serology section, and I was about to perform an ASO titer test. And I saw query pandas, and I thought, what on earth is that? And I actually thought it was a bit of a rubbish test. So I thought, bit of CPD, make it a bit interesting. And I found out that pandas is paediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. Bit of a mouthful again. And then I did a bit of a case study and I found out how paediatric patients present. And someone, somewhere along the line, associated these symptoms with a group A streptococcus, so this is a bacteria, with a group A strep or strep pyogenes infection. Diagnosis is a little bit vague, but that's where the ASO titer test comes in. So what really happens is the patient has a strep infection, but then there's molecular mimicry. Anybody heard of that? Yeah, a little bit louder for me. No? Okay, great. So the molecules of strep bacteria initially evade detection in the immune system by appearing really similar to the molecules found in the heart, in joints, in skin, and in brain tissue. But eventually they get detected. But because they're so similar, the body then attacks all of these types of molecules. And that's when we get an autoimmune disease. And the immune system goes into overdrive, and then we get these really, really strange symptoms. But this is where the ASO test comes in. And this is why I quite like serology, because some of it is really, really hands-on. So what we're doing is a latex agglutination test. So what we're doing on this card here is we're literally just looking for clumping. And you really don't need to understand this test, but what you can see there is 3200, bottom left-hand corner, little bit of white clumping, and then the next box, there is no clumping. So this is detecting an antibody-antigen complex. And then you can visually see 3,200 international units per mil. The cutoff is around 200. And then in these patients, they're monitored over time, and you would start to see the titer start to drop. Antibiotics can treat this type of infection, but then you might need something like CBT to address some of the more psychiatric elements of this condition. So I'm just going to close with why virology or why serology. And for me, it really is the infinite number of clinical scenarios. I said right at the beginning, I have no idea how many viruses there are. And there's still days that something gets written on a form and I think, I don't even know what that is. Is there a test available for that? The number of clinical details on the request form. How does that link in with that virus or with that serological test? And what one result means for yourself will be different for you, for someone who's pregnant, for someone who's immunosuppressed, for someone who's just a member of the general public. So that's what I really want to convey, is that every day is different. And I think actually you're going to start to see a bit of a theme throughout the day. It's just really what inspires you. Thank you. And I'd like to invite Frances onto the stage, who is going to speak to you about clinical microbiology.
Hello everyone. I'll just set my timer so I get 10 minutes as well. Thank you. So I'll get started. So my name is Frances. I'm the laboratory manager of microbiology at Great Ormond Street Hospital. I'm also a HSST clinical scientist as well. So I'm going to just talk about my story going through clinical microbiology, because I think I've seen quite a few things and have a different perspective as well, which I think is quite good to know what's out there. So I studied at biomedical science at the University of Essex. I heard some people over there. I didn't actually do a placement year. I do advise doing it, but I didn't do it. But what the University of Essex did offer me was a summer school. So I actually attended, and I had a week getting to see each of the different disciplines, and I fell in love with microbiology, seeing the agar plates, parasites. It was just, I was in love with it. So I did do a placement year, finished my degree, and then after I completed that, graduated, and then started looking for work. And I was lucky to get a trainee position. At that point, I completed the portfolio. And I was at Basildon Hospital for 3 years where I did that, working on the specialist portfolio. I then moved to Great Ormond Street, where I became a specialist biomedical scientist and completed that portfolio, as well as the MSc in clinical microbiology at Queen Mary, which is not actually an accredited degree, but they've got a new one now. So at that point, I then was appointed training officer of microbiology. Following that was deputy lab manager. I then wanted to do HSST. So went through SCP, but it's really great now that actually biomedical scientists now have an opportunity to get onto HSST. So there's that career opportunity too, which I think is really, really good. So I'm going to be a bit mean and pick. What do we think clinical microbiology is? Anyone want to have a guess? Say anything? No? Okay, I won't be me then. But I usually try and break it down into two terms. So clinical, obviously patient, treatment, management, diagnosing infection, and then microbiology. Microbiology is broken down into different terms. So I would say bacteria, viruses, fungi, parasites. Has a key role with infection prevention control. So actually when you're identifying pathogens, those results go to the infection control team. They need to actually isolate patients. They may need to put measures in place such as cleaning and prevent the spread of infection. Determine whether an infection is actually hospital acquired or community acquired. It's really important because we want to make sure patients are safe. And yeah, just treatment and management as well, because once you've ID'd an infection, you can then treat the patient appropriately, and that's the main crux of it. That's why I do my job, and that's why I like clinical microbiology, because it has such an impact. And actually identifying that bug and then being able to give the patient the correct treatment, that antibiotic, that antifungal, and that antiviral will make such a difference, or putting in treatments. And a negative result is just as important as well. So bacteriology. So when I started in bacteriology, it was really quite hands-on. We have different culture media with different antibiotics and indicators in. You usually add different sample types and incubate for certain periods of time, depending on what you want to isolate. There's a number of ways to identify pathogens, such as bacterial identification tests, such as the oxidase tests, catalase. We now have gone into the realms of mass spec, so you may have all heard of MALDI-TOF. Anyone? Yeah. So it's matrix-assisted laser deabsorption ionization time of flight. So it's actually identifying pathogens very, very quickly using mass spec and measuring proteomics. So for me, it was a revolution because it's basically improved patient care. We can get results out much more quickly. And I think what we've done that's even more impressive with MALDI-TOF is actually it's changing in terms of new innovation, such as typing CP detection, so looking for those really resistant bugs, so we can change prescribing habits. So yeah, bacteriology, and I think it's just the science of actually looking at agar. Some people might think it's gross, but I think it's really, really cool. And it's quite a skill, because the first time I went into a microlab, when I was shown different plates and different pathogens, I was like, how do you know which one is which? But it really is a skill to ID. Just to go on to the next slide, virology, which Cherie's covered. But when I started it, gosh, actually I was still doing cell culture. A lot of it's moved now to PCR, also genotyping and sequencing as well, so that we can identify link types, especially like with things like COVID. Mycology, this might look a bit gross, but every lab has their mycology expert or guru. I do a little bit of mycology, but I'll admit I'm not an expert, and we have our little guru that I'll pass the plate to and get their knowledge and expertise, and I'm just fascinated because there's so much technology out there, but it's not all 100%. There's 18 SPCR, 23 SPCR, but actually in terms of identification, it's not always right, and I found issues with that. So actually knowledge is still there for mycology, and so you always have that special person there to do that. Parasitology, I also really, really like parasites. I've seen some quite interesting ones in patients. Generally it tends to be patients who've come from abroad. You see their clinical details, and then you think, okay, they've come from this region, they may have this parasite. We had a child come from Africa who had schistosoma hematobium, and it was actually a urine sample. When I saw that, I was just fascinated. It was just like, everyone came into the lab, we're all looking, and it's just like, oh my gosh, I can't believe this. It's, you don't see it that often, but yeah, parasites are quite cool. Might be gross for some people. So what makes me love clinical microbiology? So as a scientist, I love it because every sample does have a story. I'm very fortunate in the lab that I work that we have a close relationship as a team. So as like lab manager, and when I was a scientist as well on the bench, we'd work together with the clinicians, would come and talk to us about patient stories, which is really, really key. And I also felt like a detective because, for example, if there was a patient that was rushed in, and obviously where I work now is a specialist hospital, so when a sample comes in, we really, really investigate it. We'll do additional tests to try and determine what that pathogen is so that they can be on the right treatment. And so it really does feel like detective work. Have you put the correct culture media up? What are the clinical details? Should we be looking for this? It really is. And I think the teamwork is really, really key in clinical microbiology, which is what I love, working as part of a team, because everyone plays their role, as we saw in that video earlier, which I think is really key to see. Research and innovation. I think this is quite a key part of clinical microbiology. microbiology is constantly changing. You've probably heard about AMR, so antimicrobial resistance, and it is ever growing. There is so much resistance coming about, and it's quite scary. And there's also new innovations. I mentioned MALDI-TOF, typing, whole genome sequencing, and it's all developing. And I mean, this might be an area you're interested to go into, and it will be ever changing, so there'll always be work to go in there. And yeah, I think research is quite a key part. So I think clinical microbiology as a career pathway, I think there's loads of different opportunities. And again, it's finding your niche, whether you want to be on the bench and be that person looking at the organisms, identifying and having that key role and that specialist knowledge. As I mentioned about HSST, it's obviously now there's that opportunity as a biomedical scientist if you want to go into that role, or whether you want to specialise in quality. Everyone plays their part. So yeah, just to kind of summarise, I like clinical microbiology because it's a diverse science specialism: bacteria, viruses, mycology, fungi, parasites. Feel like a detective because again, you're doing that clinical investigation where you're informed, you make decisions. It's a lot about thinking, and what I like is every day is something new, because a new sample will come, a new patient will come, it'll be a new investigation, and something will be completely different. I think with clinical microbiology now, the career pathway has changed as well, so there is scope for further development if you want to go that way. It is a lot of work. Before we used to have consultant microbiologists who are medics, but that is changing, so there's opportunity to uplift skills that way as well. That's it from me.
Fantastic. So we've got about 7 or 8 minutes before our next talk, so I really just want to open up the floor. If anybody's got any questions, if anybody's got a question about perhaps a specialism that wasn't mentioned, that you maybe want me to take away and go and ask someone. Anybody got any question that just wants to open up the floor? No one's got a question? If you're sitting there thinking about that question, I guarantee it's somebody else is thinking about that question. Lovely.
Anyone in cellular pathology?
Not here at the moment. Have you got a specific question you're interested in, or?
No, I just wanted to know about if there's anyone researching.
Not with us today, but come and see me at the end and I can certainly put you in touch with someone. Absolutely, yeah. Yes?
Sorry, can you tell us what's the difference between biomedical scientists and clinical scientists? There is this STP program, and what's that about?
So they're ever so slightly different. I don't know, Francis, if you're better placed to pick that one up.
You should be kind of open to whatever turns up, really. So here I am. I am a lecturer. I'm a university lecturer, and I'm the chief examiner in virology for the IBMS and a member of the council as of last year. And I've written lots of 3 textbooks and lots of journal articles. And during the pandemic, suddenly turned out I'm actually quite good at explaining virology to people, particularly on BBC local radio. So I've done a lot of. How did that happen? I just don't know. I'm standing here thinking, I'm not sure how that happened. So if you're the other thing that when I was sort of first starting out, I used to look at people thinking, oh, I'll never get to where they've got to. You know, look how much experience they've got. And there was a little bit of how do I get that job, but I'll never get to that point. So these, as the people were saying before, I don't think very many people have a career plan. It just sort of, if you're open, things will happen. But you do have to take risks sometimes. That's the thing I think I'll tell you here. So I've sort of broken it down in a slightly different way, but the first thing I did was I trained as a biomedical scientist. So I'm sort of trying not to make it about me personally, but this is the sort of thing that I would recommend that you do. So I'm so old that it was completely different. There was no degree in biomedical science when I started. I did my first degree in microbiology. And in fact, it was in the time when HIV was just coming along. And a bit like COVID now, HIV was like really trendy and everyone wanted to do work in HIV. All the people in my degree were like, oh yes, I'm going to go and find a cure for AIDS. And I was like, yeah, I'm not going to do what everyone else is doing. I do not. If everybody's doing something, I'm really likely to not do it. So I was like, oh, and I actually applied to do a PhD in mycology, in funguses. which didn't work out for various reasons. And then I realised that I wanted the biomedical scientist is the thing I wanted to do. And so I applied for all the jobs in microbiology sort of areas that I could find, and the virologists were the first ones to offer me a job. That's literally how I got into virology, because they offered me the job, so I took it. Anyway, so for you, get your degree in biomedical science, and some of you might be doing a different degree, you might want to do your equivalents, but hopefully most of you are actually doing an accredited BSc in biomedical science, and then get your certificate of competence, and then get your HCPC registration. Even if you're not really sure if you want to work in a diagnostic lab at this point, get your HCPC registration, because you will always have that to fall back on. As we'll see various times in my career where I've sort of, haven't been working out for whatever reason, I've had a bit of a high, I could always do a locum. And it keeps your hand in the profession, but also you'll always have a work, you know. My husband, who's an out and out academic, went straight from school to university to PhD. He's actually quite jealous, because if all the universities closed and we all lost our jobs, I'd still be able to work, and he wouldn't. So it's a really useful thing to have, quite apart from all the things you'll learn from it. It's a useful thing to just have as a kind of a fallback position if you need it. I worked, the other thing that you can do, I worked in diagnostic laboratories, I worked in different countries, but as well as different parts of the UK. But what you can do with having got your degree and your HCPC registration, you can go and work in a diagnostic laboratory, as you were just hearing about. You can go and work in a research laboratory. There are research posts for biomedical scientists, and you can work in clinical trials and all sorts of things like that. And again, your professional registration will help you to get a good job in those areas, because it's a kind of, that professional standing will help to get you started on your career path. The other thing is that a lot of people think, oh yes, I'd really like to do a PhD, I'd really like to do research. And when somebody comes to me and says, oh Dr. Pitt, I really want to do a PhD, I was like, what is your burning research question? Some people think, if I do a PhD, I'll get a better job, I'll have a better salary, people will like me more, or whatever it is. I don't know. Some people, just because they think, oh, it's the next target they want to hit, only decide to go into research if you really think, I really want to spend time thinking about this. Sometimes it's quite a minute, little, tiny, obscure area of a quite an obscure field. You've really got to get lost in that. But you've got to get to the point where you really want to know the answer to that research question. And it isn't for everybody. It's just the way some people's minds and interests work in some ways, and some people's it doesn't. It's not a, everybody's different in that sense. But if you really want to do research, I've seen people kind of force themselves to do a PhD and then either dropped out before they finished or got their PhD and then not done anything useful with it, because it wasn't really quite for them. So that's a question you do need to ask yourself. But, I'm not trying to put you off, but it is, just think about what's really right for you. I've got quite a lot of further academic qualifications, but probably most of you would go on and do an MSc, even if you're working in a diagnostic laboratory, and that's a really useful thing to have. You can do your MSc in something that's a little bit off the side to what your main discipline is. So, for example, if you're in microbiology, you might want to do your PhD in virology or even MSc virology or immunology or something, or perhaps mycology, kind of specialise. Then there are a lot of IBMS qualifications. I don't know how much of those you're aware, but we have obviously you do your registration portfolio, then your specialist portfolio. We've got certificates of achievement in all sorts of areas, diplomas, and we're actually writing new qualifications all the time to respond to the way the profession's changing. Then there's a higher specialist diploma and the higher specialist scientific training and all those other things that you can do. And what do you want to do? So in my case, I've also got a teaching and learning qualification, which then took me into university lecturing. But do you really want to be a university lecturer, or do you want to be a clinical scientist? And as I've said here, you don't necessarily cut off one path by following one. If an opportunity comes up to do a bit of lecturing and you do a teaching and learning qualification, that's not going to stop you going into clinical scientists later. In fact, it's going to help you, because the broader your experience, the better, the more confident you feel when it comes to doing more senior things. But you do need to think, do I really want to do this? because most of the things we're talking about, we're standing up and saying, oh, it's really, they're quite hard, and they do need commitment. And so, you know, you need to think seriously about what you want to do. But once you've worked out what it is you really want to do, what you'll find, hopefully, is that if you work conscientiously and consistently, you will actually develop experience and knowledge and confidence without even realising it. I had no idea that I'd be able to explain virology to the general public on the radio. No idea at all, until I started doing it. But then I've got 30 years worth of experience behind me that I hadn't even realised that had even happened. It just sort of happened. And it turns out that it just, without you realising it, we undersell ourselves so much as biomedical scientists. We let the doctors sort of take the glory for things. When they're talking about hospitals, they talk about doctors and nurses. Very occasionally they'll mention physiotherapists, if you're really lucky. But we're very much under the radar. We like hiding under the radar, it's fine. But we do, because we're sort of undersold by the rest of the world, I think we sometimes undersell ourselves, and we shouldn't do that. And I'm hoping that you, as the next generation, won't do that. You won't make that mistake. You'll actually say, we are biomedical scientists and we are proud of that, and we want to tell the world what we do and why what we do is really important. But the way to get to that is to challenge yourself. If someone asks you to do a job and you're thinking, I'm not really sure whether I can do that, I'm not sure whether I'm up for this, whatever. Just think that person's seen something in you that you may not have seen in yourself, and go for it. The worst thing that can happen, someone says, would you like to be the training officer in this lab? And you think, oh, I don't know. I don't try to do teaching, and you know, what do I know about anything? And the worst thing that can happen is it can turn out actually being a training officer isn't suited for you, and after 6 months you have to say, well, I can't really do this anymore. The best thing that can happen, it turns out you're really good at training, but you're never going to know unless you try, and you do have to kind of put yourself out there sometimes to try things. The other thing is, you need to be prepared for, I say, turns out you didn't want to be a training officer. One of the things I'm trying to do, which you'll find if you do go into research, is you do have to apply for funding for your project. And you spend hours and hours, days, weeks sometimes preparing, filling in all the forms, getting in all the information, costings for all the things you're going to do, getting all the, and then writing the proposal and references and getting colleagues to say they'll collaborate with you and so on and so forth. You have to put it into this particular website in this particular format by this particular date, and it's like really, really stressful. And then 3 months later they say, oh yes, thanks very much, you haven't been successful. Or sometimes you don't hear at all. They say, if you don't hear anything after the 12th of February, then assume you didn't get it. You have to be prepared for those kind of setbacks sometimes. But obviously, if you are going to any kind of research, R&D, thinking about new ways of training, new ways of management, find colleagues to advise you and collaborate with you. The IBMS is full of great people, and this is kind of what we're here for, is to help you to learn how to collaborate. I can say word now. The other thing you might find you're quite good is teaching and training. Developing your writing skills is really important, even if you're not going to go into be a university lecturer. Writing reports clearly and precisely and concisely for other people in other healthcare areas is really important. So that's something you can practice by writing articles for the Biomedical Scientist magazine. Start there, or Pathology in Practice, and write up your papers for the British Journal of Biomedical Science. Support your professional written magazines, and just try it. Try explaining things. If you can explain something to your granny, that means you probably understood it yourself. And if you can't, it means you probably didn't. You need to go back and have another go. The other thing is, as the previous speakers were there, they're really enthusiastic about their subjects. And if you ask me about microbiology, I'd probably never stop talking. Be really interested in your subject. And again, as they were saying earlier, you might take a few goes to find out what really interests you, which you might change disciplines a couple of times. But once you've found the one that really suits you, just put all your heart and soul into doing your best. That's the way to go. That would be my advice, really. So how you can make something happen for you, whatever that's going to be. My career's been really odd, really kind of, I wouldn't say it's quite unique, but it's been really strange. Get your IBMS registration, your HCP registration, sorry. Be involved in the IBMS. The IBMS is only as good as we make it. It's for us. Don't sit on the sideline and say, oh, the IBMS didn't do anything for me. If they're not doing something you think they should be doing, get involved and try and influence them from inside. That's what we've all done. Be honest and realistic about what your strengths and weaknesses actually are. So don't be afraid of putting yourself out there and getting a setback. But then when something doesn't quite go as you thought it might go, think, oh, okay, why was that? And then you might have to kind of reevaluate where you thought you were going and be realistic sometimes. But the one thing I would say is, whatever you're going to do with your careers, if an opportunity comes up, you absolutely have to take it. I did my PhD, an opportunity came up for me to do a PhD, and I thought, this opportunity doesn't come up for people like me. The sort of thing that came up, medics are often asked to do MDs and things like that, and people who are at universities get opportunity. I wasn't at a university at that time, I was still working in a diagnostic lab. The opportunity came up and I thought, this is a big, big risk, but it's not going to come again. I have to take it. I put myself up for election for the IBMS Council last year thinking, what am I doing? But I have to take this risk. And so I took it. So if whatever you do, take your opportunities, and good luck is all I can say. Thank you.
So we're going to move on to marketing and sales. Neil?
Well, sort of. Yeah.
Lovely. Come on.
Okay. Hi everyone. I'd just like to say that I've only just, after a long career, moved into marketing and sales. So I can show you some transferable skills of from being within biomedical science and then making a decision to make a change. And of course you can go lots of different ways, and this is just the way I chose. So I commenced my career way long ago in 1983, I think it was, as a biomedical scientist in the Royal Army Medical Corps. Okay, so that gave me the skills first to be a soldier and also to be a biomedical scientist. So as well as doing multidisciplinary biomedical science at the time, we didn't separate into haematology, biochemistry, histology, microbiology. So it was all in together. So you became a jack of all trades. But I like to think that we knew a lot about all subjects because the training was so long and difficult. But yeah. So as well as being a biomedical scientist, in your local hospital in say in Cambridge or something, I could go and be a biomedical scientist in Brunei, in Belize, in Hong Kong, in Germany. So that opened up a big area. And I know the next person's going to be talking more about the military, but I spent 15 years there, and then I moved into the public health laboratory service. So I've been a biomedical scientist for my whole career, but I've never worked in the NHS. So it just shows you that there are different avenues that you can go in. So I moved into public health. So I was in a public health laboratory service, which is now the UK HSA. It's just changed from PHE last year. I left last year from PHE. And when I was in that service, I started off as a junior, and I worked all the way up to the lead microbiology public health scientist in the UK. How I did it, I have absolutely no idea. I blagged it. I tell you what, I just blagged it. I started my career as dyslexic, and I thought, people told me, oh, you're never going to do anything. Well, smash through those glass ceilings, guys, because there are lots of opportunities there, and you just got to take it. You just got to go with it. Okay, so just one little area that I worked within while I was in the PhD was in 2014 with the Ebola epidemic came along, and it just so happened that because I was in the military, I'd got military skills. Because I was in PhD, I'd got microbiology skills and public health skills, and so I was asked, will you go over to Sierra Leone and set up and lead the setup of the containment level 4 labs? And of course, I said yes. You had to volunteer, but I was kind of coerced into volunteering. But of course I was going to say yes, because I got an unusual skill set that I could take because I was having to talk. We had to talk to the military over there, the civilians over there, and we set the lab up from the African bush. The first thing I had to do was get water. So we had to dig boreholes, electricity. So we didn't go into labs, we had to build the labs. Okay, so there's lots of different areas that you can work within public health and biomedical science. It doesn't necessarily, you don't have to be, stood in a lab pressing a machine or turning an ADOG plate over. Okay, so anyway, so I did my work over in Sierra Leone for a couple of years. Came back to the UK and was just starting to slow down, thinking I've done enough now, and coronavirus hit. So I was heavily involved with setting up the coronavirus testing around the labs around the UK, and then I moved over to the more research environment of COG UK. Has everybody heard of COG UK? So all these variants. Yeah, all the genomics, yeah. So all the variants that have come out, it's basically COG UK have identified those variants. So we were running the genomic service across the UK. So did that, and then I decided, right, enough's enough. I've had enough, and I thought, right, I'm going to retire. So I was old enough because I've had a long career, and I thought, right, I'm going. I left in August. About 3 weeks into August, I thought, I'm on board. I've got loads to do. I've got loads of skills that just getting out on my motorbike every day gets a bit boring, And I thought, winter's coming. I need to get myself a job. So I went into sales and marketing. I am working for a pro lab and medical wires, helping them as a scientific advisor. So I don't necessarily do the sales, but I help train the guys that go out and do the sales, and I'll happily go out with them. So it's a world that is the importance of sales and marketing over the last 2 years has just been immense. I mean, if we didn't have these sort of conferences where you interface your scientists with your sales and marketing team, you wouldn't have the relationships to then be able to hit with a pandemic, because it's hurt them as much as it's hurt you guys, particularly you guys in molecular and virology and microbiology that have probably been working very hard over the last 2 years. The science community, the sales and marketing community have also had those issues of having to scale up. Companies have grown overnight. They've been given loads of extra money to help support the pandemic, and now we're just going into a period where it's coming to an end. What do I do with all these extra staff and things like that? So you have to think about how you can realistically move it on. And what you've got to remember is a lot of the people that are in sales and marketing are biomedical scientists. They may not have been up the bench for a while, but they are biomedical scientists. So you shouldn't just assume that they're a salesman. If anyone called me a salesman, I couldn't sell anything. And I don't ever want to in that respect. But it's a fantastic career to go into. I sit and watch. go to the stands and just go and talk to somebody and get them to just tell you about their product. And it's fantastic. The passion that they go into it, and you know, it's all about relationships. It's not just sales, marketing. I mean, I rose through management in the labs, but it's all about relationship management. You know, how do you look after your staff, or how do you interact with your staff? You know, it's things like that. So, and that's, as I say, it's not just it's not just in sales and marketing, it's everywhere. So I think I'll probably leave it there, unless if anybody's got any questions or anything. I'm more than happy to go through. And I think we're going to hear a lot more about the military, as somebody who's in the military now, but my time was quite a while ago.
Thank you.
How are you? You're all students, yeah? All biomedical scientists, right? We're all excited to do it. Right career path. Do I have to sit in the mic?
If you can project, I'm more than
Can you hear me in the
happy to
back?
go around.
Oh, nice. I like to walk, all right? So I'm a military biomedical scientist, yeah? That means I'm in the military, all right? I'm in the Army, okay? You could be in the Army, you could be in the Navy, you could be in the RAF, all right? We all do the same job. We're multidiscipline BMSs. That means I do hematology, clinical chemistry, microbiology, transfusion, all right? So we as military biomedical scientists can do that in a tent, on a boat, and if you're RAF in a hotel, all right? Don't get back and chill out a little bit, okay? So we do that at different scales. So we take the stuff that you're learning now to be biomedical scientists, the stuff you're learning in your labs, the stuff you're learning in university, and we take you on and we teach you how to do that somewhere different, all right? Not in the NHS, all right? Not the white clean benches. I've delivered diagnostic pathology in a cow shed, okay? In Albania, it's true, all right? So we have to look at your quality management systems, we do that. We look at quality control, we do that. We give the highest standard we can give in the field, all right? And there's a caveat, and you've got to be pretty bright. I'm not pretty bright, all right? All right, kind of them. All right, but you have to be able to deliver a diagnostic service, a high quality diagnostic service under extreme conditions. And that's what we do, all right? I joined the military because I didn't know what I wanted to do. Similar, I did an HNC in biomedical science. I joined the Army. Many of us did, 22 years ago. I look about 39. No, can you still hear me in the back? Roger, okay. So I've done 22 years. I started off as a private soldier, and I worked my way up, and up, and up, and up, and I'm now a major, all right? So that's the top, currently, of my column, but I get an opportunity to move on outside of that. We give our guys the opportunity to do master's degrees, teaching degrees. They can do doctorates, clinical scientists, all right? If you show an aptitude, and you want to do something, we'll support you. Because it's in our interests. Because we want highly motivated people who are smart. All right? We like smart. People don't know about you. All right? Medical services, what are they? Doctors and nurses, aren't they? Oh, it's doctors and nurses. Ambulances sometimes, paramedics, okay? So we, on deployment, biomedical scientists, we shoot up the ziggurat. They understand what we do. Because we're delivering blood, we're doing diagnostic tests, right? We're in ED, we're talking to the anaesthetist and the doctors because we're delivering those products, blood components, at site, all right? You don't see that in the trust here in your NHS. What are we? What have we been? What have we seen? Pods with samples coming down. And you process, don't you? And you put on your results. And you think, nobody knows who I am. Nobody cares who I am. Yeah? In the military, they get it. All right? And you sit in a position where you can make a difference. They don't care if you're a corporal. They don't care if you're a colonel. They care about what you know as a subject matter expert. And it could be the only BMS in a hospital delivering a service. Hanging out, on call, delivering it all. but you talk, and you can talk with the colonels, and you can talk with the commanding officers, and they will listen, all right? They will listen. Any questions? So I found out about this about 10 minutes ago, so I'm blagging it. All right? I'm bluffing it.
Dan, I'm going to ask one.
Yes.
And I don't know about anyone else here, but it's only been in recent years that I've found out that you can be a biomedical scientist in the military. So if someone was interested in going down this route, where would they start? What would you signpost them to?
So, YouTube's good, isn't it? Everybody likes to look on YouTube. There are Army recruitment centers, there are RAF recruitment centers, there are Navy recruitment centers. You can go in if you can build up to get through the door. All right? Once you're through the door, have a chat. And have a chat to them, because they'll know there's Army, Navy, or RAF biomedical scientists. The problem you have is there's not many of us. So they don't recruit very often, but it's worth asking. All right? Because guarantee it, because where I sit currently, I'm responsible person blood for the MOD, so I oversee all the blood distributed globally for our troops. It's my responsibility to assure it to the Secretary of State of Defense. I am also the quality assurance manager for defense pathology, so I assure all of the tests, make sure they're correct, right, valid. I am also the head of CADA. What that means as head of CADA is if you're interested and you go to a recruitment center, they will send me your CV, which means I can have a look at it. And if I think you look good, I don't want a mugshot. If I think you look good, all right, we can take a punt sometimes, yeah? And we'll look at it for you. Do you know, I've looked at other CADAs with degrees, all right, your degrees. And they've gone in, I want something medical. I went in, I want something medical. I want to be a CMT in the movies, medic! I want to be that guy, right? I didn't get to be that guy. They took me into something else. And something else. And I found my way to what I love, all right, and what I do. And 22 years later, my knees are knackered. I've got a bit of weight, because I sit at the desk all the time now. But I've enjoyed every minute of it, all right? And I'm deployed. 3 Iraqs, 2 Afghans, Albania, Germany, everywhere. All right, I've seen the world. Drunk fairly. All right? But I've enjoyed it, and I've saved lives. And I've seen lives saved. And I've gone into the ward and seen that person. And I've been in A&E and I've seen that person. And I've cross-matched the units, and I've taken those units to the bedside and seen them put up. And that's something that I've had, that not many people have. Any questions?
Do you have to have a certain level of experiences to apply? Like a year in the lab or
Nah, like good ed. We'll take someone with A levels and we'll train you through. All right? We'll take someone with an HCPC registered degree and we'll get you accredited. All right? We'll take you with a doctorate. I had one doctor arrive. He was a doctorate in food technology. So she was doctor private at one point while we got her banged in the shape. All right? It's you we're after. It's the drive and the intellect and the wanting to make a difference that we're after. All right? If you come to us, we'll try and get you however we can. You got to interview. All right? Anybody's got to interview for a job. You sit in front of me and you tell me about yourself. Okay? That's what we got. Any other questions? Yeah?
How different are the labs when it comes to defence VMS compared to if you're working in the NHS? What's the facility? How different are the labs? Different are the labs and facilities like from where you work?
Okay, so the question was how different are the labs where I work? All right? So military BMS, day in, day out, they work alongside the NHS. All right? They keep current. They work alongside the NHS. That's what they do in the meat and potatoes. All right? When I need to deploy them, we lift them and we push them out. They could be under a tent with a trestle table and the centrifuge rocking everything and all these samples going everywhere and dust blowing in, all right? And we have to adapt and overcome. We can also go on ship, you know? Army will go on ship, Navy will go in the field. We're kind of tri-discipline, multi-discipline, and we're interchangeable, all right? So you can sunbathe on the front of an aircraft carrier, you know, and occasionally use a store sample, all right? But you do all that stuff. But as a military BMS, you're able, competent, and confident to lean your hand into microbiology, hematology, transfusion. Yep.
Lovely. We're just going to stop it there. We've got a really big network, so we can put you in touch with possibly Dan or one of his colleagues. So come and find me at the end. Come and find me in the break. It is a really niche area, and I could listen to you all day. But we do really need to take it there. So round of applause for Dan, please. And I'd like to welcome Wendy up onto the stage. Thank you. Wendy is going to be talking to you about training. And then we're going to have a really brief break at the end. I'm really conscious that we've got a really packed schedule. Some of you are waiting for coaches at the end of the day. We are going to claw it back. We are going to have a proper break in a bit. Thank you. Thank you, Wendy.
Hello. Hi. Right. So apparently I've only got 10 minutes. So lightning quick. And I was asked to talk about alternative career pathways in diagnostic pathology. So I am the head of learning and development for a company, we go by many names. Sonic Healthcare UK is like the umbrella term, but also HSL and TDL might have hit your radar. So we provide diagnostic pathology. You can see one of our labs on the screen there. We're quite lucky in the environment, in the labs that we've got. They tend to be fairly new. But we are across the UK, and we're one of the bigger laboratory companies, and that means that we've got quite a few different opportunities, particularly around kind of alternative career pathways. So this is something you should all be familiar with. It's the kind of like traditional, familiar job titles, biomedical scientist, clinical scientist, you know, the NHS pay bands, healthcare scientist. That's the normal stuff. And I'm going to touch base on the more alternative, perhaps more unusual roles that are out there. So again, traditional disciplines, all very familiar to you. This is how most of the pathology laboratories operate across the UK. You know, NHS, private, doesn't matter which kind of like area you're in, they all have these as standard departments and disciplines. So I'm going to look at the options, and this is a really important question. These kind of like additional alternative career pathways, is it you add it onto the day job, or is it a standalone role? And I think this is where it's really important, and it's the scale of the organisation you're working in as to how they answer that question. Again, traditionally, a lot of laboratories will have these roles added onto day jobs, like existing roles. So you've got things like all sorts of areas, which we'll cover in a second, but this is a really important one because it's either being tagged on to an existing role or it's a standalone. So kind of areas that, again, fairly typical. Health and safety, you'll find each lab has a health and safety rep, has a quality manager, has, you know, the training lead. I've definitely fulfilled that role in some of the labs I've worked in, and it is definitely an add-on to the day job. I've been a training officer whilst working right at the start of my career, 24-hour shifts. That was fun, particularly when the clocks go back and you actually work 25 hours. Really soul destroying when the clock on the wall is telling you it's home time and it's not, you've still got an hour to go. So I vividly remember marking portfolio work at 3 AM when I'm on call because it's the only time I've had. So that was fun, but you know, had its moments as well. IT, I think, is an area that's really starting to build up. Pathology has always been hugely reliant on IT, there's no question about it. But it's always been kind of managed separately or managed by IT people who don't understand pathology, who haven't got the experience in pathology. And we're starting to see that we're actually taking people who've worked in pathology, biomedical scientists, who are migrating into IT roles. And that's hugely beneficial for the service because they've got the skill sets of both. They understand what the service needs to deliver, but they've got the IT technical skills that can actually deliver on it. Operations, probably we tend to call it operations these days, but it's management. It's being a lab manager. It's taking on those people management roles. And when I was working in the laboratory, that was kind of the route for progression. You got up to your senior biomedical scientist where you could be your quality lead, your training lead. The only next step was lab manager. And I love working with people. I love dealing with people. Don't like managing people. I didn't go to university and study really hard in biomedical science to become a manager, and that wasn't a route I wanted to do. So I kind of carved my route in training, and I very luckily ended up as the head of learning development. So I've really been able to kind of like stay in the field I wanted. But that is again a skill set. Management is not something we're trained for. When you've all done science degrees, you've worked in biomedical science, that's where your background is, and then you've got to people manage, and that's a very different thing. And as a result, you can have some bad managers out there, and it's really unfortunate. But it's because we're not training people up to have that right skill. And then finally, research. That we've always done research. There's been lots of research going around, but again, it's always been added onto a day job. And if you're in a particular lab that has a focus on research, that's where you can have those kind of standalone roles and really build that up. So again, that's still familiar support areas. They're definitely routes for avenues, but they do tend to be add-ons to day jobs, typically, unless you're in a bigger organisation. So we have a quality management team whose sole job is quality management. We've got a health and safety team. They're focused on health and safety. And when you start building in these kind of like standalone departments, that's where you get a bit more flexibility around it and who can go into those roles. And you can really start going outside the box a little bit more and kind of like pulling in people that perhaps wouldn't necessarily fit into the laboratory biomedical scientist role. So there's two areas I want to spotlight as areas that I think are up and coming, really interesting, and I think is kind of like worth a thought across it. But I will just kind of like just be aware that we're quite unique in Sonic Healthcare at the scale of the organisation, which has allowed us to build up these teams. So just be aware that they're not necessarily going to be available across the board. So we've got engineering. And this is our engineering team. We're very unusual in having an actual standalone engineering team to support the analyzers and equipment that we use within the business. We have a building called the Halo building, which is a very tall building in London. And have any of you come across a track system? Do you know what that means when I say, analyzers work on a track? Yeah. Anyone don't know it? Because I'm very happy to explain it. Excellent, I'll go over that. So, analyzers are typically standalone. So, that's, I don't have a pointer, but that photo there, like all those white boxes, that's an analyzer. How do you get the samples onto that analyzer? Typically, you'd have a person who'd pick them up and load them onto an analyzer. A track automates it. So picture some kind of super duper Scalextrics, remote controlled car track system around a lab, and you literally just load it on in one point, and then the track fires off samples all the way around the place, and they go onto the analyzer, they do their thing on the analyzer, they then pop back off onto the track, and they might, depending on what tests are requested, go to a different analyzer, and the IT then manages and prioritizes which tests. It can be as complicated as brainiac as knowing that, okay, that analyzer is running low on that reagent, so I'll only fire off a small number, and then I'll divert the rest to another analyzer that's got plenty of reagent on there. That one's got an error on it, I'll shut that one down. So that kind of links into the IT of getting all of that kind of like software programmed and built so that it actually works properly. So that's a track system, and in the other picture, you can just see this helix, well, it is a helix, but that thing in the background. Normally a track just operates on one level. So that's it. We have a 10-story building in London, and that track goes up and down as well, and it goes through these little helixes. So they basically go up a spiral and then back down a spiral. It's really cool to look at. And when we first put it into this building, we're the only company in the UK that has put a track in on this scale. And we love being first in doing stuff, but that does mean we have to put up with the glitches and all the little gremlins that come with being the first of doing something. And when we first went live, as expected, there were a few little blips. we had people going inside those spirals to try and fish out a sample. It's a bit of a tight squeeze, I have to say. But you know, there were up step ladders and somebody hanging onto their legs, leaning down into it. But you know, it became really, the track became its own thing. And we suddenly realised that instead of it just being like all the laboratory scientists and the support staff who would normally just manage quite a small track and it'd all be fine, this was actually, in order to keep it ticking over and running, we needed a team who knew this track inside and out. And that's where the engineering team started, with the formation of this track. But that role has expanded, and now they are the first point of contact for all the analysers. So in a lab, if an analyser goes wrong, you pick up the phone. I mean, you do some basic troubleshooting, but then you pick up the phone to the company and say, it broke, don't know what to do, please can you come out and fix it? And they'll send an engineer out. And that normally was where the engineering role existed in pathology. You would go and work for one of the kind of companies like Abbott or Sysmex or Siemens, and you would know your particular company's analyzer, and your job would be to fired off to all sorts of labs all over your area and go fix them. We started building up our engineering team to have that same skill set, and we worked with the companies that the analyzers we have, and they got additional training. So they can't do everything, but they are on site and advanced troubleshooters to be able to fix all the analyzers that we have in our laboratory. So we have definitely seen this team grow in skill and in size, but also in the kind of like the importance that we view them. They are a really crucial part of the team that help our laboratories keep going day after day. So I think that is a really interesting area. If you're kind of keen to kind of like, you know, have more of a technical hands-on, then engineering is a really interesting area. If you ever liked, I don't know, I didn't do it, but I remember my brother always used to love like taking apart toasters and putting them back together again, and you know, they never worked afterwards, but yeah, we didn't burn down the house, so that was a success. But you know, if you're interested in those kind of things, that might be an interesting pathway to go down, while still being in the biomedical science field, still being involved in those kind of patient pathways. So I thought that was an interesting kind of area to showcase as an alternative pathway. And the other one I want to flag is data. Data is everything. Big data, you know, there's huge amounts. There's a lot of kind of like looking at big data to see how that can inform treatments, patient pathways, streamlining, efficiency, all sorts of buzzwords out there. In a kind of, how do you apply that and how does that work in pathology in an actual role? We have a business intelligence team, and their sole role is looking at how data can be put in a format that helps the processing, you know, the lab processes, the operation, the day-to-day working of a laboratory. There's lots of different things out there. We use Tableau as just a piece of software. It's basically a data visualization software that can take data from all different data sources and make it look pretty. That's essentially what it does. And I have some pretty graphs on the screen to show you. The front one is my favourite. It is my table. It's set up for my report, and I pick the colours because I think they're pretty. But that is a really important area, and it's all sorts of things where you can monitor turnaround times of your samples. So you've probably seen, I don't know, on TV, you know, Casualty or, you know, whatever TV shows on there, but they'll have like waiting times on a big screen. So-and-so's about to breach their 4-hour waiting time in A&E, all of those kind of things. We have all of that stuff in the laboratories around samples. You know, it might be that we've tapped these reports into our laboratory information system, and you know, so-and-so's sample was booked in 32 minutes ago, it's now breached our 30-minute turnaround time, so it kind of flags up. You can monitor maintenance of analyzers. That analyzer hasn't had its maintenance ticked off today, you know, and it's big flashing on a flat screen in the laboratory. This particular report at the front is my training data. So I manage a learning management system, which is basically e-learning. It's a training website. And I have certain courses on there. Mandatory training. Mandatory training is never an exciting area. You never get people excited about doing their mandatory training. GDPR is what it is. but it's a necessary evil. Everyone's got to do it, and I spend my life nagging people to get their mandatory training done. So I built a report to just see the kind of engagement around these courses. And here and here, so these two bits, you can see they start here. They were new courses that I created, and they were set as mandatory, and we had to do it. So you can suddenly see there was a flurry of activity, and then it tails off. And you can kind of also see that there's kind of like peaks and troughs, which normally like fit in around holidays, maybe weekends, shift patterns. And I find that quite useful to see the kind of engagement, what course is perhaps a little bit more popular than the other. Do people, when we're predicting kind of like in future, did everyone do it all in one go, which means they're all going to expire again, you know, in a year or 2 years' time. Helps me plan ahead whether I should do any kind of like comms out to remind people that there's going to be an expiry coming up. So there's a huge amount of work about connecting different systems, quality management systems, LIMS systems, training systems, and then kind of like putting that all together and working with the laboratories to display that information in a way that helps them do their day job. So that again is, I think, a really interesting area that perhaps isn't your typical role that's available around. I just want to, hopefully those are the two areas that I really wanted to spotlight, as I personally think are interesting. But I do want to just give you a word of warning. HCPC registration is not going to go anywhere. So if you want to be a biomedical scientist working in a laboratory, you've got to get your HCPC registration. If you can't write, because the engineering roles, the data roles, you won't necessarily have to have HCPC registration to do it. So that's what I was saying about kind of like, we're allowed to be more flexible. We can widen the pool of people that we're recruiting into. That's really great for us. But if you kind of end up working as an engineer, looking after these analyzers, but at the back of your mind, you're just like, this isn't really what I want to do. I want to be authorizing results. I want to be the other end of it. And you want to be a biomedical scientist. That's fantastic. But I really didn't want anyone to think that this was like a way of bypassing HCPC registration. Unfortunately, that is not an option. If you want to be a biomedical scientist, you've got to get your registration. So I just wanted to put that word of warning in there just to make sure there was I didn't mislead you on anything. And I feel like I've chatted very, very quickly and thrown a lot of information at you. But any questions? Yes.
Thanks, Wendy. I'm one of them kind of at the University of Essex. Do you accept placement? It's very interesting area. Do you accept placement students?
We do, yes. So we tend to work with local universities where possible. And in London, we've got quite a few. But we do have like labs up north as well. So we look at local universities there. But yes, we do offer them. It's always a bit of an interesting challenge to do it because they're very popular. But no, we do. We offer all sorts of training. We've on any given day, we've probably got about 50 to 60 registration portfolios under training at any given time. Probably about 35 specialist portfolios. I mean, it's across the organisation. It's not on any one site, but that's the only way that we develop our staff is by supporting their training. So absolutely.
Yeah, thank you.
Okay, round of applause for Wendy. We are ever so slightly running over, but I'm conscious that we've been sitting here, sat down for a while. So if you want to go and take a quick comfort break, please don't go far, and we'll start sharp in 5 minutes. We do have a bigger break a little bit later on. Thank you.
Just to let you know.
I work within the industry that you're all hopefully looking to join. An overview of Zenopa. We're based in Buckinghamshire, but we recruit for scientific and healthcare roles all across the UK and also in Europe. So in terms of the sectors we cover the pharmaceutical industry, diagnostics, life science, and a lot of the companies that are here exhibiting, we work in partnership with. So when they're looking for new candidates or new people to join them, they ask us to help them find kind of the correct candidate. So in terms of the candidates we recruit for, that's across all levels. So entry level, such as yourself, so graduates. We also work with PhDs and then healthcare professionals that have been working for however many years. So in terms of the scientific industry, if someone said to you a career in science, I think a lot of people might automatically assume that means working in a lab, being a scientist, or working in some kind of lab-based environment. But actually that's not the case at all. Our core area of business is the commercial scientific sector. So for people that might have a passion for science, but want to be in more of a customer-facing role or out and about in the field, visiting different labs rather than staying in one place, we recruit for those kinds of positions. So in terms of some of the roles we cover, that's such as scientific sales, scientific marketing, product specialists and product management. We also do more of the technical roles, so application specialists or maybe office-based technical support. Some of the representatives that you would have seen here today as well in the main hall, so it's their job to come to these exhibitions and educate you on their products as well, and we recruit for representatives such as that. So in terms of the opportunities available to you upon completing your studies, there's obviously a lot of different routes to take, so I'm just kind of here to make you aware of some of the other options available. In terms of picking the route you want to go down, it is important to focus on what drives you, what your motivators are. So for some of you, you might love working in a lab, being hands-on, a lot more practical, whereas other people might want to go out and talk to people, maybe more of a varied environment. So it's just thinking about your own motivations and where you think that fits in with your long-term career path. So the first step in securing your ideal role is deciding what it is that you can see yourself doing long term and then putting all your efforts into making that happen. So once you've decided the types of roles or the routes you want to take, it's then important to make yourself attractive to those companies. It's all well and good knowing that you want to go into scientific sales, but how is a company going to view you as a candidate? So as a recruitment consultant, we've got more of an insight as to what companies are looking for. They're looking for individuals with genuine passion and interest in the industry. Your CV should be a reflection of that. So it shouldn't just be a standard, this is my education, I'll go for any job that will take me. It's really important to highlight in your profile section what you're looking for, your own interests, and why you're interested in moving into these types of positions. And as a recruiter, that's the first thing we scan for when looking at CVs. We also recruit for candidates across a range of different platforms. So for example, job boards such as CV Library, Reed, and then also more social media based such as LinkedIn. So if you are looking for new positions, it's really important to get yourself out there, broadcast yourself on those platforms and start making a network. Even if that's not how you end up getting your first job, that could be how you get your second, your third, and how you build a career and contacts in the industry long term. So in terms of the recruitment process and how companies such as Zenopa can help you, it's very easy to register. It's just sending across your CV and an overview of the roles you're interested in. We then give you a call, we talk through your background and your experience, and we essentially help you find your dream job. So as a recruitment consultant, we're essentially a matchmaking agency, but for candidates and clients rather than, something else. We guide you through the process fully. So in terms of your initial application to the company, we then coach you through the interview process. We also do kind of practice interviews. For example, if you've never been in a commercial interview, it can be quite a scary thing. So we help coach there. And then also, if you do get a job offer, we help you negotiate the best deals. We help you find the right company. For example, you might get offered a few different positions and we help you kind of consult as to what would be the best choice for yourself. So kind of in summary of what we can offer you, in terms of when you first enter the industry, it can all be a bit overwhelming. Zenopa has the benefit of over 30 years working in this space. The majority of the people here we work with, we've got those connections and we can help provide that inside information that you might not have just by looking at their website. We're there to kind of provide that more in-depth knowledge and be more consultative to you. And once you've finished your studies and you're graduating and you're looking for that next step, there's so many opportunities out there. It's important that you have someone that can help guide you through that process. Whether that is looking for a role in the lab or looking in an office or in a field, Zenopa is someone that can help you with that. So my advice to you would be to think about what you enjoy doing and what you're looking to do long term, and then put all of your efforts into that and using your CV and your experience to really help you get there. So Zenopa's purpose is to help you find your ideal role, and hopefully when you are all ready to start looking, we can play a part in that for you. Thank you. I don't know if there's any questions or anything.
So I've got a question. How would somebody contact Zenopa if somebody's listening thinking, yeah, I need help, I need a few links and how I'm going to get into that. How would they get in touch with Zenopa?
So we do have a stand here today in the reception and kind of foyer area, stand R9, with big red Zenopa on the board, so we're easy to find. I'll be here as well if you want to grab me, and we can give out some business cards. But if you are interested, just grab one of us and we can get you in contact. It's really simple, just drop us an email and then you never know, we could get you your first role in the industry.
Fab, any more questions? No? Great, lovely, thank you.
Thank you.
So I'd now like to welcome Tahmina onto stage. Tahmina is an IBMS Council member, wealth of experience, and she's going to jump straight in with some top tips for trainees. Thank you.
Thank you, Sheri. So as Sheri said, I'm Tahmina, Council member with the IBMS. Just give you a bit of an introduction as to how I got to where I am. Can everyone hear me? So I started off 12 years ago, like many of you guys sat here today, as a student. I did the Applied Biomedical Science programme at MMU, and I completed a 12-month placement at the Christie Hospital. Did that over 12 months. After completing my placement, I went back to university to complete my final year of the degree. On completion, I was then offered a job at the Christie as an MLA. So I did that for about 6 months, and a position came up in the biochemistry department, which I was successful in securing. Sort of rotated around biochemistry, haematology and transfusion for about 12 months, and I decided I wanted to specialise in haematology and transfusion. So I went on to complete the specialist diploma with the IBMS in haematology and transfusion.
and also completed a master's at the same time in haematology and transfusion. Around the same time, I also completed the IBMS Certificate of Expert Practice in Training, because I realised I absolutely loved the training and education side of things when it came to the profession. And I was able to then apply for a more senior position as a blood sciences training officer. Since then, I've gone on to complete different qualifications in my role, quality management, leadership and management. And I was then able to expand my role from blood sciences training officer to pathology training coordinator. And that involved looking after histology, cytogenetics, mortuary and bereavement, as well as biochem, haematology and transfusion. I've more recently joined the University of Salford as a lecturer in biomedical sciences. Outside of my daily role, I'm also doing quite a lot of work with the IBMS as a registration portfolio verifier, examiner for specialist portfolios. I also assess non-accredited degrees. I do other things with the Science Council, sit on the Registration Authority Committee, and also sit on the Education Profession Standards Committee with the IBMS. So I'll talk you through the benefits of placements. Based on my experience, the uptake of placements is highly competitive. Therefore, it's extremely important to apply for a placement if the opportunity is available. Without this, I wouldn't have been able to complete my training and become a HCPC registered biomedical scientist. The benefits are huge. You'll gain experience while working in a lab, developing your knowledge and skills, as well as significantly improving your opportunities for employability. If you're unable to secure a placement through university, try and contact local laboratories to ask whether there's any work experience opportunities. Connect with the local IBMS branch and also look on NHS jobs for vacancies advertised or MLA positions or associate practitioners to try and get your foot in the door. Just some tips while you're on placement about maintaining professionalism. So have good attendance and timekeeping. If you're going to be late for any reason, make sure you inform the department that you're working in. Be reliable, contact your manager immediately and directly if you're unable to attend work due to an illness or any other reason. Be enthusiastic and keen to learn, ask lots of questions, show that you're interested, keen, be proactive. If you don't know something, ask. There's no such thing as a stupid question. The more questions you ask, the more you learn. Also a big one, don't use your mobile phone in the lab when you're on a placement unless it's for an emergency. If you're expecting a call, speak to the senior that you're working in the department that you're working in on the day. But I've seen trainees come into the lab sometimes, and not just from an infection control purpose. If you're easily distracted, you could make mistakes, and we've got patients at the end of the day where we're processing samples, so it's really important that you don't use your phone in the lab. Thank you. Follow policies and procedures, so make sure once you've read the SOPs, you're actually following the policies, signing them as well as you've read them. Maintain confidentiality, so a big one again. You're dealing with patients. Sometimes you might come across a patient or a relative of someone that you know. You need to make sure that you're maintaining confidentiality, because if you breach it, it does have serious consequences on your professionalism, and the HCPC can get involved as well. Just common ones, dressing appropriately, smart, casual. Some tips for portfolios. Make sure you read your portfolio at the beginning of the placement so you know what to expect. So you've got the different modules, you've got section 1 and section 2, and then the 5 modules in each of the sections. If you read through it, you know what kind of things to be looking out for when you're on placement. You might come across certain things. Keep copies of them and put them in your folder. So when you need it, you can just pull them out and submit it into the different sections. Start collecting your evidences early, which I've just mentioned. Ask for regular feedback as well. If you've had a period of time where you've not had your training officer look at the work, try and submit things regularly and ask for feedback so you can go back and amend things if required. Also, try and make sure you've set targets for yourself so you're able to complete your portfolio in a manageable time frame. And be organised. You'll be juggling work and the portfolio, so make sure you prioritise it and stay focused so you can achieve those targets. Having a plan can help you stay motivated, but make sure you look after your own health and well-being, so take rest in between and take annual leave if you need to. So I'll talk you through some examples of evidence. You've got things like audits. Try and get involved because evidence from audits can be submitted to as part of your portfolio in the quality section. They can be boring, a lot of people don't like doing them, but I secretly enjoyed them, and they are really good evidences for CPD as well. Things like error logs are also really good pieces of evidence because you can annotate them and demonstrate that you've understood the root cause of the error and how to prevent that error and avoid it from happening again, and also reflect on it to show how you've learnt from that experience and made improvements. The same goes for incident reports. Things like EQA exercises as well are really good pieces of evidence. Once you've annotated them and put them into your portfolio, they can apply to lots of different areas, especially quality. Case studies where you might have come across an abnormal result, try and photocopy that, keep it in your portfolio, and when you need it, you can pull it out, especially for the demonstrating the scientific knowledge and applying it to practice. Reflections are a big one as well. So once you become qualified as a HCPC registered biomedical scientist, you are expected to maintain CPD. So if you start getting used to reflecting on experiences from now, it will make it easier throughout your career. Also things like maintenance records. Once you've done your maintenance on an analyzer, keeping a record once you've signed it, and again slotting it into the area that it fits into in your portfolio. Same goes for QC and calibration logs, annotating SOPs, training logs. Competency assessments, again, are a really good one for your portfolio because you have your knowledge section and then you've got your competencies. And here your training logs and competencies can again tick off those boxes. Minutes of meetings that you've attended are really good for demonstrating evidence for the communication section. Statutory and mandatory training and things like validation and verification reports also go really well in the portfolio. Any problems that you've had with sample and request forms as well, so you might have mislabeled samples or a request form that hasn't been labelled correctly. Start collecting those pieces of evidence early, so when you do come to the section in your portfolio, you can submit it. Teamwork. Build good relationships with your colleagues. Understand what your role in the team is. You've got a really important role, even if you are a student and a trainee. You are valued and you are part of the team. Just remember that there's a patient at the end of a sample waiting for it to be processed so that results can be available as soon as possible. Listen carefully when being trained on a task. Take notes and ask questions if you need to and if you need any help. Be a supportive team member and proactively offer help and support to the team. So things that you can be getting involved in. Take the initiative to get involved in doing problem solving and troubleshooting. There's a huge difference between knowing what to do when things go right and knowing what to do when things go wrong. You learn a lot through troubleshooting, and this will also help boost your confidence. Say yes to as many opportunities as possible. Go to lunchtime CPD sessions, perhaps volunteer to deliver a session yourself on a case study, which again is an excellent example for your portfolio. Take part in any public engagement activities if you can. If the workplace is celebrating things like Biomedical Science Day or National Pathology Week, volunteer to help out. This will not only show that you're being proactive, but it will help with teamwork skills, confidence, public speaking and leadership skills. So communication. Be polite and professional when communicating with colleagues. That goes without saying. Follow instructions carefully, write notes if you need to so you can refer to them later, and take responsibility for your actions. If you make a mistake, learn from them, ask for feedback and write it up as a reflection. It would make an excellent piece of evidence for your portfolio as well. So in terms of quality, understand the process of accreditation. It's an extremely important part of working as a biomedical scientist. It demonstrates that you're serious about learning, also knowing what accreditation means. It will benefit you during interviews if you get asked a question on the subject as well. So have a good knowledge of the ISO 15189 standards and why we abide by these standards to maintain accreditation. Ensure you know the different methods of ensuring quality and recording examples. These are potential examples of evidence for your portfolio as well. Have enough knowledge to be an effective member of the team in maintaining compliance. Ask to learn and observe how SOPs are written, and learn and write up how validation and verifications are performed if if there's an opportunity to do so in the lab. Ask to get involved with audits. If you're able to complete an audit, it's an excellent piece of evidence for your portfolio. So, reflection. When you're on placement, keep a small book in your lab coat pocket and write mini reflections throughout the week. Even if it's a sentence at the end of the day, keeping a reflective logbook, it's an excellent way of recording your learning experiences, thoughts, feelings and reflections. It should be thought of as a critical assessment of how you're progressing during your placement. In using the word critical, it's not thought of as a negative assessment, it's an honest reflection on what's going well, what improvements can be made and how it can benefit the service user. This also helps you get used to reflecting on your experiences, and it's really good practice for CPD. Don't feel like you have to struggle through if you're finding it difficult. There'll be lots of colleagues who are willing to support you. If the work you're doing isn't what you would expected or hoped for, speak to your training officer. But you need to remember that almost all jobs will involve aspects that we enjoy and some that we're less keen on, so there's a degree of flexibility that's important. If you feel you're unable to do the work you're given because of confidence, be honest, speak to your training officer. They're there to support you and they'll help put plans in place to develop your confidence. It's public engagement. Joining the IBMS, it's a perfect way to kickstart your journey in biomedical science. Being an IBMS student member not only looks great on your CV, but will also enable you to show your commitment to the profession. As a member, you'll have free online subscription to the monthly magazine, The Biomedical Scientist, and you'll have access to a range of resources and offers which helps you learn more and keep up to date with biomedical science. Apply for grants, awards and bursaries that can help you in your studies. You can also access support and advice for careers, placements and information on how to become HCPC registered. You'll also have an opportunity to network with experienced biomedical science professionals, meet with peers to find out what it's like to work in the profession, and receive weekly and monthly e-newsletters. So as I said before, try and get involved in things like Biomedical Science Day, raise awareness to the public of our profession. Use social media platform. It's become increasingly popular, especially Twitter. And I'm going to mention the IBMS chat that Sheri is responsible for. It's a really good way of getting yourself out there. It's a good opportunity to get yourself networking with other professionals. You learn a lot. Even if you don't want to sort of participate by posting something, there's so much that you can catch up on later by reading on the posts. I can see a few of you nodding in here, so that's a good sign. Also, National Pathology Week highlights the important role we play in healthcare. So again, trying to get involved in those kind of events if you're on a placement. And taking part in activities, things like careers talks to schools and things. It does help with your public speaking and confidence. And I've already mentioned IBMS chat. So that takes place on Twitter on the first Wednesday of every month, between 8 and 9 PM, and it covers various topics like CPD, portfolios, professional development, and interview prep. There's also the IBMS mentoring program that you can look into, which will match a mentor to yourself if you put in where you're up to in your career and what you're looking for. Networking. So whether you're a student or a professional, networking is one of the most important things you can do to advance your career. Remember to build your connections early while you're studying. Start approaching early and ask around. Let your network know that you're available simply through LinkedIn. I think Maya mentioned earlier about LinkedIn, so it's a really good resource. So try and start utilising that now. When you start building relationships, you do get noticed, and it opens doors to opportunities which you might not have seen or thought of. It also helps to build your confidence. The more people you meet, the more you step out of your comfort zone and build invaluable social skills and self-confidence. And you can use these skills throughout your professional life, and you can also receive instant career advice and support from experienced professionals. I've already said, grab every opportunity going. So things like job applications. When you're searching for a placement or applying for a position as a biomedical scientist, include key points in your CV that stand out to the employers. Your CV is about selling yourself and increasing your chances of being shortlisted for an interview. Include your qualifications, how many years of experience you have, what skills you've developed, what training you've previously completed. Make sure you include your roles and responsibilities in a particular job and relate them to the position that you're applying for. Employers will be looking for skills that relate to biomedical science. So keep your CV clear and concise and make sure it flows well. and include any other courses that you've completed, such as mentorship or any extracurricular activities that can add to your skills. So prepare well for interviews, sell yourself with the qualities and skills that you've highlighted in your CV, relate it to the job description and the person's specification, think about your strengths and weaknesses and how these can be used to your advantage. Most importantly, employers will want to know why you want the job, but also what benefits you can bring. So for biomedical scientist jobs, most employers will ask specific competency-based questions, so be prepared to answer using past experiences. Examples of questions can be talking about your biggest achievement and why you're proud of this, or also things like behavioural questions or scenarios, say, give us an example of when you worked under pressure. Research the common tests performed in the lab. So if you're applying for a job in haematology and transfusion, find out what tests are performed in that lab and how they're performed, and take your time to answer questions. Don't be afraid to ask your own questions as well. And at the end of the interview, ask for feedback once they've come back to you to let you know whether you're successful or not. Ask them if they'd be happy to provide feedback and act on that feedback. Any questions?
I mean, since a nice presentation, you've been showcasing how much you have done in your spare time. How did you organize your time to ensure that you still complete your degree and you still carry on going upwards of a positive trajectory? How did you do your time management on that?
Time management. I think it depends on how passionate you are. I think if you're really enthusiastic, you'll make that time. I'm not saying it's easy. Obviously, you're working full time and you've got a life outside of work. But for me personally, I think it was from about 2015 onwards that I realised it was training that I really wanted to go into. So I put myself out there. I know that when you're in a job and you're working in a lab, sometimes it's not always easy to do the extra things that you want. So I kind of put myself forward and it kind of grew organically. I was putting my hand up for extra responsibilities. Some of it I was doing in my own time, and I also did shift work. So when I was working night shifts, I was on my own in the lab looking after biochem, haematology and transfusion, and you'd have quiet periods. So I'd make sure I'd first cover the bench work, do what needed to be done, do any of my admin type tasks, and then focus on anything else outside of work that I could be doing. I did a lot of it during night times. It wasn't easy. In 2015, I started my master's, and I was also working night shifts, and I'd just gone back to work after maternity leave. For me, nights worked really well, especially working on the night shifts and things, making use of that time. I'd also say when you're learning on the job, sometimes people might see some of these extra things as extra work, but a lot of it is down to CPD as well. So something you might be doing as part of your job that you're not actually realising you're developing skills without knowing. So a lot of that, I think, when I was working in my role as training officer, a lot of the activities I kind of separated them out and looked at some of the tasks that I could kind of put in my CV and how they contributed towards teamwork, confidence, leadership skills. Is that all right? Any other questions? Thank you for listening.
Thank you. So we'll welcome Sheri up, and just as Sheri's getting ready, I just want to bring up 2 points. So first of all, grab a pen and grab a pad if it's not in your hand, because I'm going to give you a web link of UK HSA who are advertising for placements right now, and the deadline is the 21st of March. Now you might not want to go into a placement, but at least you can look at that job spec and what's required and start thinking about how you might write an application. What I am going to say first though, it is another plug for IBMS Chat. Tahmina put a plethora of top tips up on the screen, and I don't know about you, but I can't write very fast. But the beauty of IBMS Chat is everything's almost bookmarked and kept on Twitter for perhaps as long as the original poster deletes it. So all you need to do is put hashtag IBMS CHAT into Twitter along with a keyword to bring up a thread or a tweet. A couple of keywords I put down there. I know we've definitely covered interviews, we've definitely covered jobs, applications, placements, registration, careers in biomedical science. IBMS Chat's been going on since 2018, so you're going to be overwhelmed with the amount of tweets that come up, but then you're going to be able to click on a link or get those top tips that Tahmina mentioned. So let me give you that link, because I did say I would give that to you. So www.health, HEALTH, jobs UK, so all one word, healthjobsuk.com /job, JOB, /V for Victor, and then I'm going to give you a couple of numbers, so 3991084. So I'm just going to read that back to you. So that's www.healthjobsuk.com /job /V3991084. So even if you're not interested in placements, you can have a look at what's required and start thinking about how you would.
I've just watched them type that in real time.
Amazing! There we go. Thank you. Lovely. Welcome, Sheri.
No worries, I've got to wait for my slides now. just while I'm waiting for my slides to appear, can I just do a bit of a quick poll to wake you all up, because you've been brilliant, and welcome to IBMS. Who is here for the first time today? Brilliant. Now, first year students, second year students, third year students, graduates. Mix. Brilliant. And masters. And masters. I apologise. We do have those students going from our master's courses. So, I'm Sheri Scott. I am a senior lecturer at Nottingham Trent University. I am a practice-based lecturer. I have worked for 20 plus years in clinical biochemistry before I decided that my passion for training wasn't being realised. So I moved to the university to do it full time. So I took my main role at the university, as well as course lead for our apprenticeship students, is to advocate for placements and to help our students develop employability skills so that if they want to be a biomedical scientist, they can achieve that. So, how do I get... I think they're going to have to do it for me. So, no, please say no. So, I'm a lecturer, so I start every lecture with some objectives. So if you are going to be doing some reflection today, you might want to link to these objectives. So I'm going to be helping you gain an understanding of what we mean by placements. I'm going to give you an insight into the expectations and responsibilities of placements, and also help you gain some knowledge on how to secure some placements. There are some quite heavy text slides because I love to throw information in there. Please feel free to take as many pictures as you want. Don't worry about trying to jot it all down. A lot of this information will be invaluable to you if you go for a placement interview. So, one of the questions they might ask you on an interview is, what is a biomedical scientist? What do you understand by the roles? Well, biomedical science can cover all sorts of disciplines. I'm biochemistry. Cheri's microbiology, and I got that right, which was really. Yeah. Tahmina was haematology, blood sciences, but there's also genetics, andrology, cell path. There are lots of different disciplines. Just because you're going into a placement in one particular discipline doesn't mean that's where you might end up as a biomedical scientist. It's a generic qualification in the registration portfolio, so bear that in mind. But that being said, you want to do your research. If you're going to go into a placement, you want to try and have some idea of the lab that you're going to be going into. Biomedical scientist is a very important role. We play a major role in getting the diagnostic test results to the clinicians. 70% of those diagnoses made by the clinicians are as a result of the work that biomedical scientists do. And I don't think it's really emphasised enough that biomedical science is there, or the biomedical scientist is there to protect the public. There has been a lot of talk about it's difficult to get into the profession. There's been a lot of talk about the need for an accredited degree. But this is all to protect the public. You need a level of training and knowledge to be able to do that role. Training is fundamental to quality and safe practice. So, where do our biomedical scientists work? Well, 2 examples, the clinical labs, the public health. That is not the end of the story. Biomedical scientists can work in many different roles. I work in HE. I've also got other hats. I work for the Science Council. You can work for NICE. You can work for NEQAS, which is involved in quality assurance. You can work in research laboratories. You can work, as I say, in NHSBT, in veterinary labs. You can work for the Military of Defence. There are lots of different roles out there. And once you get into those roles, you progress, so you can go into quality, into training, into management. But there's some fundamentals that we understand from the role of biomedical scientists. But it's also worth knowing that there is something that fits all. There are lots of different disciplines with lots of different attributes. So some biomedical scientists will work 9 till 5. Not as many as they did. But other biomedical scientists work 24/7, 365 days a year. Before I went into academia, I worked either Christmas or New Year for 20 plus years. I now get Christmas off, it's great. There is a decent wage associated with a qualified biomedical scientist, but there's also the option to earn more through extra roles or through doing out of hours work. So as I say, but we don't go into the role for money. We go into the role because we've got that passion for patients, but we don't necessarily want to be patient-facing. But you can be as a biomedical scientist. It's all about the science. It's all about that patient care. It's all about evolving your knowledge. One thing you need to be prepared for if you're entering a career as a biomedical scientist, your learning, your knowledge does not stop when you leave your course. So, I want to just touch on a little bit about regulation and professionalism. It's been possibly covered before in the earlier slides, but this again will come up in any interview when you're going for a trainee biomedical scientist role or a placement interview role. It's an important service. Because of that, you need to uphold the reputation of your professional body. You need to meet the minimum requirements of the standards of the HCPC. So, you need to do your research. What is the IBMS all about? What is the HCPC all about? What is the difference between the two? And I've done a little bit of your homework for you, so just to give you a bit of an overview. So IBMS, they're the main professional body. They're the ones that have put on this fabulous event over the next few days. And make the most of it. Trying to get out of the lab when you're in there is a little bit more difficult, isn't it? They publish educational resources, so there is lots of support for students that are wanting to get into the profession. They promote the role. We love doing the job we do, so we want more people to go into that role. And it is, many of you will know that having an accredited degree is a really big advantage when you want to be a biomedical scientist. They also publish professional guidance. So there is guidance there for us to practice so that we perform that safe and quality service. Whereas HCPC, they're the ones setting those standards, those 15 standards of proficiency that we are expected to evidence against and perform and continually maintain at a high level. So there's conduct standards. There's proficiency standards, but there's also the CPD standards, and this is great CPD, not only for you guys, But for me as well, I am developing my communication skills, and I had to do a bit of research to make sure I hadn't missed anything out in these slides. So, why do placement? Well, it took me 10 minutes, but I finally got to the topic of my talk. A biomedical scientist is a legally protected title. You cannot call yourself a biomedical scientist unless you have met those standards of proficiency of the HCPC. You can work in a clinical assessment role, but you are not biomedical scientist unless you have got that certificate of competence or are registered with the HCPC. So you need that knowledge and that competencies. So you need the academic program that met the knowledge requirements of the HCPC. So we had that IBMS accreditation, we have the HCPC accreditation. And a degree can be accredited by both, but it's looking at what standards of knowledge you need to be able to perform the role to a safe and quality standard. But we say you need that knowledge, but you need to be able to apply that knowledge. So the placement is your opportunity to get that foot in the door. For NTU, we have 270 biomedical science students a year, give or take a few. They don't all want to be biomedical scientists, but if they did, it'll be the ones that have got their certificate of competence from doing a placement that will be the ones that get the jobs first. They'll be the ones that do well in their final year, because we have a placements between years 2 and 3, that perform slightly better in their final year because they're applying what they've learned out on placement back in university. So if they've done a placement in haematology, they're going to do really well in their haematology module. And if they do microbiology, they're going to do really well on their infectious disease module. So you're looking for a placement, not only to get this certificate of competence, but it also is really good to find out, is this a career I really want? This is how I work in the real world. So it gives you real life skills, it gives you networking contacts, and I would say at least 50% of my degree students that have been on a placement have actually got jobs lined up before graduation through the networking that they've done and by showing how they can act in a professional manner on their placement. So it's legally protected, and it's something that you need, this placement, to get you that leg up, that foot in the door, as I've said. So what does it mean to be registered? Well, you've got a duty of care to the service user, whether that be the patient, the clinician, or someone that's visiting the lab to perform some maintenance on a piece of equipment. You've got to uphold the reputation of your professional body and your profession. So you're working to a particular code of conduct and ethics. And you need to remember that when you're going for the placement, right from when you go for an interview and you're conducting yourselves in a professional manner to when you actually go out at 9 after you're registered. Because you're on a register, you need to stay on that register. So you don't want to bring the profession into disrepute. You need to have that commitment to lifelong learning, and you also need to be fully aware of the fitness to practice requirement, whether that's due to your own mental health and well-being, or down to whether you're actually fit to practice or scope of practice. Are you trained to do a particular test? So go out, research the HCPC, research the IBMS, find out what it's all about, and have a look at those 15 standards of proficiency. They will potentially come up in your interviews, but not only that, you will start to recognise some of the key words of things you are already doing at university. So, what is the IBMS training placement? It's this portfolio, this registration portfolio is a collection of evidence. As Tahmina said, you are taking opportunities from your training in the lab to build a portfolio. How many of you do a skills portfolio through your universities? Some of you? This is basically what the registration portfolio is, but you're bringing your evidence towards the standards of proficiency. And those standards of proficiency could be something like health and safety, data protection, equality and diversity, right through to performing standard investigations. So what skills do you need to go on to placement and be a biomedical scientist? Well, you need analytical skills. You need to be able to problem solve. You need to be able to work things out. You need that practical lab experience. So when you're writing your CV or in your interview, showcase the practical experience that you've done at university. Show examples of where you've been able to prioritise tasks, because you'll be expected to do that in a role as a biomedical scientist. You need to show flexibility, being able to adapt. There's been a lot of adaptation over the last couple of years, haven't there, Cherie? Yeah. Think about attention to detail. Check your CVs, check your applications. If you can submit a CV with a mistake on, it doesn't set you up to be working in the lab because you had that need for, you put a skill down as attention to detail and then you've got a spelling error in the first line of your CV. It doesn't look good. You'll be expected to work alone. So you might have examples of where you've worked alone on a project, but you'll also be expected to work collegiately as a team. So have some examples of where you've worked as a team member. And these are the things that you'll be doing on your placement. You'll be learning to perform investigations, tests. You'll be giving results out when you've been trained to do so and recognise when those results are correct. You'll be processing samples. You'll be prioritising workload. You'll be identifying errors and abnormal results, so we will train you in that. You have to maintain the equipment that you're using, and you need to make sure that you've got the relevant stocks of materials and reagents to be able to perform those. They're key fundamental skills. But you'll also be asked to answer the telephone, so you need good communication skills. You need that attention to detail as you're recording results and recording data. You will be developing yourselves continuously. So have some examples of the CPD, continual professional development, that you do not only during your degree courses, but extracurricular, as Tahmina said. Are you a mentor? Are you participating in extracurricular events? Are you a member of any sports activities, or do you do any hobbies that can be related to those standards of proficiency? Have you got any leadership skills that you can showcase? Because again, that is something else that you will be producing evidence for. And you'll be expected to keep that professional knowledge up to date. I think I just need to cover some expectations. As Tahmina said, you've got that expectation to attend and you need dedication. It is hard work to train and study at the same time. I did my degree part-time on day release, much how the apprenticeships are at the moment. You are completing a portfolio around your work. You will hopefully get some protected time to do that, but there are no strict guarantees because the service need will always come first. It doesn't matter how many times we harp on that training is fundamental, getting the result out will supersede that every time. So be aware of that. Be willing to put in some of your own time to complete this work. You can't turn up at a lab late and expect not to get picked up about it. So it's about that professionalism, being where you said you're going to be, when you said you're going to be there. And quite often, the placements are unpaid, but that doesn't stop the employer seeing you as an employee. So they'll be asking you to tell them or request your annual leave, which seems mighty unfair when you're not getting paid, but you are a member and they will adjust their workloads and their work skills mix and their staffing around the numbers of people. When you become a valued member of staff, and you will, they will have some expectations of you because of that. Dress smart. You're going to be meeting patients in the hospitals on the way to the lab. So it doesn't matter that you'll have a lab coat on for 90% of the day. You've got to get to that lab. But there's not only the expectations of you as students, there's expectations of the student, of the employer. They are there to support you to complete the portfolio on an IBMS training placement. They are there to train you in the different skills, in the different techniques, and get you through that portfolio verification at the end of your placement. So they need to give you regular feedback. They need to mark your work and point you in the right direction. They need to give you tasks that will enable you to meet those standards of proficiency. And they generally will be expected to give you a little bit of time to help you do that. It's not unrealistic to ask them to give you some time to complete that portfolio. So have a look at the IBMS Good Professional Practice Guides. Have a look at the behaviour that's expected of you for when you graduate and you become on the register. Have a look at the HCPC standards of conduct, ethics and performance. Link that back to the standards of proficiency and think, are these qualities that I see in myself? This is what's expected of you. So how do you go about securing a placement? You now know what a placement is about. Next step is, how do I go about getting one? Well, there's lots of opportunities for placement out there. I would say there's more opportunity for a placement than there is for a trainee position after you graduate, because of the sheer numbers of students that are after those trainee positions. There might be some local advertisements. So speak to your employability teams within your universities. If you're on an accredited course and you've already got links with your course leads and your employability with local hospitals. So there might be a regular platform at your university where they can advertise these opportunities. Get onto social media, hashtag, I'm going to Twitter again, because there are opportunities that are advertised through the social media on LinkedIn and Twitter. When you do see an advert, read it carefully. Think about what supporting documents that you need, whether you need, and ask your employability teams at your universities to help you support writing your CV and application. Maybe you're not local to the area where you're at university. So contact your local lab near your home. Because these placements are unpaid, you are still eligible for a full grant because it's means tested still, but you might decide that it will be easier because you're working full time to actually do the placement nearer to your hometown. If that's the case, find out who the training officer is at the local lab. Try and get contact. Reach out. If you can get in and do a tour or there's an open day, visit it. The IBMS has a list of CPD officers. Quite often they're linked to the training officer. You might, if you get on the intranet websites of the hospitals, they will have a list of key people. Even if they're not the ones involved in employing the place or sorting out placements, they can put you in touch with the people that are. And always look for an IBMS training approved lab, because you can't complete your portfolio if that lab hasn't got that IBMS pre-registration training status. So make use of the employability team. Make use of any academics that have links with the hospitals. NTU has 9 HCPC registered members of staff. We've got links, but your local universities will also have HCPC, either lecturers that are employed full-time or guest lecturers. Catch one of the guest lecturers from your local hospitals at the end of their presentation. Ask them if they have placement students or if they could give you the contact details of people that might be able to help. Reiterate, it is unpaid, but that being said, there is usually opportunities during the placement to actually get paid. Quite a few of the labs have bank staff. Bank staff is like a temporary contract. It's like an agency worker, but is actually employed by the hospital. Once you've shown that you can actually do the job and that you're a valued member of staff, you can start signing up to this bank rota and working out of hours. Quite often that bank role can then continue into your final year of university. If you've graduated and you're after a placement, seek out work experience opportunities. And bearing in mind that, as I say, it might be a case that you might have to ask for an internship. Free labour. Who's not going to turn down free labour? But it gives you the opportunity to get the experience you need to then seek a training role, or if they see that you're doing a really good job, either get a bankroll or support you through the portfolio in your own time. So it's just be willing to, you have to put some effort in. You have to get, any experience is better than no experience. So even if this, can't get a placement in an IBMS training approved lab, because there's fierce competition out there, there's more people that want the placements than actually placements going. Get a placement in something that's related to the field that you want to go into. It will give you a benefit when you graduate, even if you can't get that portfolio. And you can download a copy of the reference copy of the registration portfolio, so you should go and start pre-collecting evidence of all the things you've done at university. One thing I definitely say is, look on your courses at the coursework that you're expected to do, and seek where those pieces of coursework can actually feed into evidence for the portfolio. So it reduces the amount of work you need to do either on that placement or in that trainee role. And quite often, if you are concerned about the unpaid nature, speak to your local employability team, because there's grants and funding on top of the maintenance alone available to you. You just need to be able to ask for it. For any NTU students, we have RISE, so that can cover the costs of a portfolio. So if the employer is unwilling to support you actually getting the portfolio, we have grants in place that can help that. So do your research, check out your local labs, check out the hospitals where they're based, check out the travelling to those hospitals to make sure that it's going to be a viable option for you, because we don't want to spend time investing in your training for you to find out that you can't complete that training placement. It disadvantages someone else. So do your research, find out what that lab's about, what they do in that lab, and it will set you up for a successful interview. And if you do know someone that works in the NHS, that works in a hospital, they might be able to give you with a key contact to get you through the door. It's all about showing that you are interested and enthusiastic for the profession. So you want to take every opportunity that's available to you. So just before you apply, think about who you need to contact. Think about how you could go about visiting the lab. Think about why you want to do that placement. Think about your skills, your experience, and how they match to those standards of proficiency. So if a question comes up, you can answer it in the interview. Make a list of possible questions you want to ask the employer. Nothing shows an enthusiastic future employee than someone that's got a list of questions about the job role, about career progression, about further study after you've finished your training placement and you're a band 5. What's next? But also remember that you will be asked to confirm your ID. So be prepared. Have all your documents to hand. It shows someone that's really prepared if you go along with everything, all your ducks in a row. Always arrive on time, whether it's your interview or when you're on placement. Demonstrate good communication skills, whether it's in person or via Teams or other virtual platform that you've got that interview. Be polite, be clear, and dress for a virtual interview exactly how you would dress for a face-to-face interview. The most successful candidates are the ones that have done the preparation beforehand. So put together that list of questions. Speak to the contact that's listed on the application form or the advert. And if possible, ask for that tour or that visit. And if you can't get a visit or a tour because of COVID restrictions, just ask to chat and ask someone in the lab about what their day is like, what equipment they use, what tests do they do. And make sure you check that application before you submit it, or get someone else to check it so that you don't include any silly mistakes. Be enthusiastic. Yeah, time. Speed on. So, just some quick ones before you go. Be aware you'll need a DBS check. You'll need to have some routine immunisations. So just some information about, speak to your local occupational health about those if you need your extra and visit your employability team, research and join the IBMS. I think that's
£12 now.
Yeah?
Yeah, £12.
Yeah. So anyway, thank you very much. There's lots of benefits from being a member of the IBMS and there's some resources there for anyone that wants it. And you can reach me on @TeachBiomed on Twitter, also searching Sheri Scott on LinkedIn, and I am always happy to help anyone that's shown an interest in becoming a biomedical scientist. Thank you.
So we are really tight for time. I do absolutely need to apologise. We haven't been able to get the tea and coffee to come to us. I know you've been really good sitting for hours now, so if you want to go for a break, let's say 15 minutes. There is free tea and coffee in the trade show. It's a little bit of a walk, so please go straight there, straight back. I'm going to be around, Sheri's going to be around, Amy's around. Come and have a chat, and we'll see you in 15 minutes. Thank you.